very honored to be able to speak with you today about coping and adjustment to change in the setting of spinal cord injury as part of our caregiver education series. So I'm Dr. Jamie Twaite. I am a neuropsychologist and rehabilitation psychologist at Burke Rehabilitation Hospital in Montefiore Medical Center. And I'll be discussing coping and adjustment to change following a spinal cord injury with a focus on some of the emotional and psychological changes that may accompany supporting your loved one with bowel and bladder management. First, I'll provide a general overview, focusing on broader issues of adjustment to spinal cord injury, focus then more specifically on considerations related to bowel and bladder management, and lastly, I'll discuss some of the potential resources available to individuals who are affected by spinal cord injury, or SCI, and their caregivers. So first off, why discuss mental health in the context of spinal cord injury, either in general or in terms of bowel and bladder health? So first, we know that spinal cord injury increases vulnerability to mental illness and other related health concerns. Adjustment difficulties, depression, and anxiety are particular concerns following spinal cord injury. There is a 1.33 greater incidence of new depression or anxiety in individuals with SCI, and 10 to 37% of individuals with SCI have depression. There is also a reciprocal relationship. Not only may SCI drive the formation or the development of mental health difficulties, but mental or behavioral health concerns may, in turn, affect well-being and physical health. So certainly these conditions may impact daily functioning. Individuals may feel less motivated or engaged in their treatment or even their daily care needs. And these illnesses can also take away from our ability to simply enjoy our lives. If we have depression, we may no longer experience pleasure from playing with our children or from doing a loved activity or hobby. And mental health conditions can also worsen other medical conditions, such as insomnia, chronic pain, infection, or substance abuse, highlighting the importance of discussing mental health openly and early on in the recovery process. It's very important to emphasize that adjustment to spinal cord injury is not a one-time event for those that are affected or their loved ones. Rather, the individual with SCI and their entire surrounding system, including loved ones, caregivers, colleagues, and so on, are continually adjusting at various stages of recovery, including later on to interactions between spinal cord injury and normal changes over the lifespan. Concerns that are common early in the adjustment process but may also evolve over time, include changes in one's identity and self-perception, loss of privacy and reduced independence, many different forms of stress, including marital, financial, or medical, loss of activities and hobbies or social isolation as a result, and there may also be burnout in family, friends, and caregivers. Healthy adjustment to spinal cord injury can be extremely challenging. There are some qualities, activities, or strategies that are associated with positive adjustment to spinal cord injury, and incorporating even some of them into your daily life can make an incredible difference. So we want to think about things such as promptly returning to a routine, keeping a daily structure of activities that are both useful and meaningful, and along those same lines, seeking meaning and purpose post-injury. Folks who adjust well also proactively problem solve as problems arise, and they may use a range of adaptive coping strategies such as acceptance, modifying the way that they think about a situation, obtaining education and seeking out information proactively, relaxation skills, and other ways of coping like the use of humor. We may also look to utilizing adaptive technology and modifications to facilitate greater independence, facilitating a connection to a social support network, and to the extent possible, focusing on reintegrating into the community post-injury. Of course, these may be much easier said than done. Some of these may be natural qualities that some folks have already, while others may not come as easily or naturally to most of us. And that's why it's so important to involve family, friends, medical, and mental health providers in this process so that there are many avenues through which to receive your support and to help someone identify their own unique and effective way of adjusting. Bowel and bladder functions specifically carry their own somewhat unique set of concerns regarding adjustment. Bowel and bladder care can also have a tremendous impact on your loved one's mental health and quality of life. As a caregiver, by being aware of these concerns in advance, you can anticipate and prepare for them and can be better equipped to navigate challenges as they arise. Concerns that are specific to bowel and bladder care often include feelings of anxiety and embarrassment related to episodes of incontinence or other aspects of care, worry about navigating in the community, maintaining employment, or sustaining social relationships, and changes in social relationships and shifting of roles. This may include discomfort with having a loved one providing intimate bowel and bladder care, worry about the perceived burden that this places on loved ones, and there may be challenges to intimate, romantic, or familial relationships because of caregiving needs, particularly around bowel and bladder care. So, how do you help as a caregiver? Bowel and bladder management often requires a team approach and clear communication between the affected individual and caregivers. You want to anticipate and collaborate with your loved one, proactively discuss bowel and bladder concerns and care with them, and problem solve. Privacy is also essential. Work to facilitate dignity whenever possible, such as by choosing the least invasive option, working to provide your loved one with as much autonomy and independence as possible. Also, openly discuss reactions to bowel and bladder accidents and general care. You may even need to confront stigma about these issues within yourself, your loved one, or other family members in the community. You can also think about how to help your loved one with managing other people's expectations. Say a family member asks, "Why didn't you attend this important family event?" This provides an opportunity to intercept and provide basic education and support your loved one. Families who are able may wish to consider professional caregiving services when appropriate in order to preserve boundaries and to maintain intimacy. And last but not least, it's really critical to identify and utilize medical services such as physiatrists, urologists, and women's health specialists. There are many ways that individuals with SCI and caregivers can facilitate healthy adjustment. Ideally, depending on your interests and access, you may want to identify a blend of different resources, both personal and medical, that will work best for you and fit best with your interests and activities. Here are a small sampling of different resources that may be available to you within the community, within your family and friends, and within professional settings. Many individuals with SCI and their caretakers will benefit from professional support with adjustment after SCI. One of the most effective therapies for treating adjustment difficulties, anxiety, and depression is called cognitive behavioral therapy. This is not what we may think of as the lying on the couch or generic talk therapy, but rather it is an active, structured treatment that is symptom and goal-oriented. This approach focuses on individuals to learn new and more effective ways of thinking. It can be provided as a standalone treatment in conjunction with other forms of psychotherapy, such as group therapy or family therapy, or in conjunction with medications provided by one of your physicians. As both the affected individual and their caregivers navigate adjustment, there are a range of services that can be considered to provide further support. Within the physician practice here at Burke, providers offer medical management of concerns related to SCI, and the Rehabilitation Psychology Service provides a range of psychotherapeutic treatments to support individuals and families with adjustment. By proactively identifying personal, family, community, and medical resources, caregivers will be better able to support their loved ones and themselves in navigating adjustment after injury and in resuming a full and meaningful life.